Welcome to QD Clinic. Still's disease or not, QD Clinic is lessons from the clinic, and I've got a good case for you. This is a 38-year-old man who came to see me a few years ago for joint pain and Still's disease. He has a past medical history of depression, bipolar disorder, and poor sleep problems. In 2009, he presented to the hospital with sore throat, malaise, chills, and then fevers of 102 to 103 daily. He had widespread aching. He took a lot of over-the-counter Motrin. He developed rashes and had very abnormal labs. He was hospitalized for 5 days. In the hospital, he had no procedures or biopsies. Had a lot of imaging. Labs showed an AST of 82, ALT of 191, albumin of 3, white count of 23,000, platelet count of 642,000. And he would have his fevers at breakfast, and then again at 9 a.m., and then again at 9 p.m. Kind of odd. He would always have chills and sweats with that. His highest recorded fever was 104 degrees Fahrenheit, but was usually 102. He was bothered a lot by weight loss of 20 pounds, nausea, vomiting, diarrhea, workup for GI problems, found nothing. He had endoscopy, nothing was found. He had ongoing myalgias and aching, but no clear-cut arthritis, although he said at one time his hands were swollen. He was given 20 milligrams of prednisone and got better. Okay. He was later diagnosed having Still's disease by his local rheumatologist, who went on to give him prednisone and methotrexate, and then after that he gave him Remicade. He had a rash. Xeljanz, he had a rash. He took Kineret for a while. That helped and really helped his labs, but he didn't like doing the injections. He was on Kineret and Minocin when I saw him, not taking methotrexate. When I saw him, I asked, when was the last time you had fevers? It was about 7 years ago. Last time he had rash or hives, 7 years ago. He currently was taking an NSAID and Kineret every day without side effects. His pain level was 7 out of 10. His disease activity level, patient global assessment, was also 7 out of 10. On my exam, he was afebrile with normal vital signs. He had no skin lesions. He had no adenopathy. His chest exam was normal. On joint exam, there was no swelling, no nodules, no deformity, no contractures. He had multiple areas of joint and soft tissue tenderness, especially around the PIPs, MCPs, knees, and ankles. His tender joint count was 11. His swollen joint count was 0. His CDI score was 25. He had tender points bilaterally in the trochanters, interscapular, and paraspinal muscles. Labs were not done at this visit. I felt that they were not necessary since I knew what he was dealing with. The question is, does he have Still's disease or not? And I guess you have to consider two ways. When he was seen 7 years ago, and he had all that fever and white count of 23,000, was that Still's disease or not? Well, it's possible. Again, his fever was atypical, right? He had no serositis, but he was seronegative. He had the quotidian fevers. He had rashes. He had a white count of 23,000, a high SED rate of 65, CRP of 121 milligrams per liter, or 12.1 milligrams per deciliter. Normal LFTs. He had abnormal LFTs. So by my criteria, he had 11 points and had the diagnosis back then. He did not meet Yamaguchi criteria, as he only had 5 points back in 7 years ago. Currently, he's got no points. He does not have Still's disease currently. His main problem right now is chronic widespread pain, soft tissue pain, poor sleep. He has a bipolar disorder. He has myofascial pain syndrome and doesn't meet criteria for fibromyalgia, but needed to be treated as such. This is why no further lab testing was done. I told the gentleman if he had ongoing complaints more than what we saw today, he should come back. He did not come back. If he had ongoing complaints, we might have considered doing genetic testing in him. But was this Still's disease or not? Not. At least not today. And I can only conjecture about what was going on in 2009 based on his reports. Tune in for more Still's or not on QD Clinics.